We're going to go over a 43-year-old female with chronic pain and swelling over the left lateral hip going on for about 7 years. There really wasn't much of an injury that initiated this, though she did lose her footing and kind of maybe twisted her leg and somehow irritated the lateral aspect of the left hip. In physical exam, she has some swelling over the lateral hip and tenderness to touch over the lateral hip. So we're going to go ahead and do an ultrasound to further evaluate. Here we're just going to go over some basic anatomy of the lateral hip. Here you can see the gluteus maximus muscle and the tensor fasciae lata muscle feeding into the ITB. Also you can see the various nerves over the gluteus maximus muscle as well. You can appreciate the posterior sacroiliac ligament. Here you can see the lateral femorocutaneous nerve going over the lateral thigh, and now we're making the ITB as well as the tensor fasciae lata and gluteus maximus translucent, as well as the gluteus medius muscle. You can see the underlying superior and inferior gluteal nerve, artery, and veins. Also can appreciate some of the musculature of the pelvic floor, including the ilio and ischio-coccygeus muscles. And now we're basically just showing the probe position of this ultrasound video. Here the probe is in a coronal plane, and now we're just bringing it into an axial plane over the lateral thigh. Here again you can see the probe in a coronal plane over the lateral hip. You can see the tensor fasciae lata muscle. You can see the capsule of the hip joint, and also get a glimpse of the labrum as well. Here's a pretty detailed list of some of the bony structures of the pelvis. You can also see the underbelly of the gluteus minimus and medius muscles as the pelvis is translucent. Here we're making the gluteus maximus and tensor fasciae lata translucent, and you can see the underlying gluteus medius and minimus muscles. And here you can see a glimpse of the gluteus medius muscle. And now we're taking some cross-sectional views of the tensor fasciae lata muscle. This is in a coronal plane, and we're just going posteriorly, and now we're starting to get into the gluteus minimus and medius muscles, as well as the capsule of the hip joint, and actually the greater trochanter itself, where you can appreciate the apex in a cross-sectional view. And now we're going a little further back in our cross-sections, and you can get a better view of the labrum as well. We're going to start our ultrasound in a coronal plane over the lateral hip. Right side of the screen is distal. You can see probably the gluteus medius tendon there. Hard to really say for sure as we're looking at the greater trochanter in a coronal plane, and it's hard to make out the different facets, but it looks like we're looking at the lateral facet and the posterior facet towards the right. So that would make that the gluteus medius tendon. Now we're going to an axial plane. Here you can see that apex of the greater trochanter, and then anteriorly to that is the anterior facet, which is where the gluteus minimus tendon inserts. Above that you can see a moderate bursitis, and then you got a thickened ITP above that as well. Here we are just scrolling around, a very thickened gluteus minimus tendon, and a pretty large bursitis you can see here. And now we're going towards the lateral facet. You can see that rounded posterior facet towards the right of the lateral facet. And this is where the gluteus medius tendon inserts. So here again you see pretty large bursitis. You see the gluteus medius tendon inserting on the lateral facet. You can see the posterior facet just to the right. There's no tendon attaching to the posterior facet, but the gluteus maximus overlies that facet. Again noted as a thickened iliotibial band.